Hello, my name is Shia Ritchie. So before we begin, I'm actually doing this project in between preceptors, so I do not have access to a speculum, gloves, and a pelvic model. So I will be using this baby hat as a pelvis and a pubic inlet, and I have these tongs as a speculum. So here we go. I will be talking to you, the audience, as my client, and we will give you the name Amani, just to make things more personal. So, hello, Amani. Today's visit is going to be a routine well-person exam focused on your overall health, and we're going to talk about prevention and any other concerns you'd like to discuss. So for this exam, we're going to go at your pace, and you can ask as many questions as you want or pause at any point or let me know whenever you feel uncomfortable. So before we start, is there anything that you're feeling nervous about or anything you want me to know to help you feel more comfortable? And at this point, there is space to express concerns and ask questions so that I can answer and make you feel more comfortable about the exam. I also want to let you know that you're in control during this exam. Consent is ongoing, and I will tell you what I'm going to do before I do anything at all. So as we begin the well-person exam, we want to review your health history and have a bit of a wellness discussion. So we're going to review your menstrual and reproductive health. And by the way, all of this stuff is going to be indicated on your intake charts that we've already done. So we'll look over your menstrual and reproductive health, your contraception use or intentions of pregnancy, your sexual health and STI screening needs, breast or chest health concerns, mental health, relationships, and safety concerns, and your lifestyle wellness. So this is your diet and nutrition, your activity, your sleep, or any substance use at all. And this visit is also about preventative care and supporting your whole health. So now I want to explain how this physical exam is going to go. So with your permission, I'll do a general exam, and that may include checking your blood pressure, heart rate, and lungs, i.e. your vitals, and possibly a breast or chest and pelvic exam, depending on your needs today. And with the breast and chest exam, this is basically going to be a verbal conversation about any concerns you might have, if you know how to do a self-exam, and if there are any concerns you want me to check at or feel for myself, we can go further into that aspect of the exam as well. So before we begin the pelvic exam, I'd like to step out of the room while you undress from the waist down and cover it with a drape that I give you. So let me know when you're ready. And then I'll explain each step before I begin. So before we begin, just know that you may feel pressure during parts of the exam, but let me know if anything feels painful, because that's not something that we want. So go ahead and lay down here. Do you feeling comfortable? Want some elevation? Great. So I'd like you to let your knees relax a little outward, kind of like in a butterfly position where you keep your feet together and your legs out, but relaxed. And if you want, I can help support your legs if it feels a little too tiresome to hold them out like this. So now I'd like you to take some slow breaths, and I'll help you get comfortable. So first I'm going to look at the external genital tissue, the vulva, labia, and surrounding skin. And I'm going to assess for just normal anatomy, check for any irritations, lesions, swelling, discharge, or any other things that I might deem abnormal. And you're going to feel my hand gently separating the labia so I can visualize the tissue. I am noting the appearance of the skin. I'm looking for any signs of infection or trauma or cysts or tenderness. Are you feeling any pain or discomfort in the area that I'm examining? Great. Okay, now I'm going to insert the speculum You may feel pressure, but it shouldn't be painful. Please tell me if it is, or if you want me to stop. So I've warmed and lubricated the speculum so that the insertion can be quicker and easier, and with barely any pain, well, with no pain at all. So what I'd like you to do is I'm going to just feel the speculum on the side of your leg here, just so you know what the texture is, how warm it is. And then before I go into your vagina, I'd like you to take a slow breath in. And when you exhale, I'm going to insert this speculum. So take a deep breath and exhale. And I'm inserting the speculum here. And I'm going to do a slight downward angle to get a visualization of your cervix. And now I'm going to very slowly open the speculum so that I can see the cervix. So what I'm looking at here are the vaginal walls and cervix, and I'm looking for healthy tissue. I'm seeing if there's any unusual discharge, if there's any lesions, maybe some inflammation or discoloration, or any other abnormalities. And everything looks really good. So now while I'm here, I'm going to take my sample brush, and I'm going to just insert into where your cervix is, and collect a little bit of a sample, just a quick swab, and I'm done. And what I'm collecting here are PAP, HPV, and STI samples, as indicated in the well-person exam today. So when I'm done here, you might feel like a slight cramp or a brief sensation. That's all very normal. You may also feel have a little bit of spotting after. Please call me if the cramping persists for more than a day, or if the bleeding gets heavier and also persists for more than a day. Finally, we're going to do a bimanual exam. So with a bimanual exam, I'm going to put 2 finger gloves in the vagina, and I want you to take a big deep breath and exhale, and I'm going to just go a little deeper here. Very good. What I want to do is sort of hook my fingers around your pubis, and with this hand I'm going to press on your abdomen to feel your uterus and ovaries. I'm feeling the cervix for position. I'm also checking for consistency. I'm checking for any tenderness. If you feel any pain, please let me know. And I'm also trying to assess the size of your uterus. I'm looking at the shape and the position as well. This is important because in the event that you would like to have children, this tells me if your uterus might be in an abnormal position that may make it difficult to birth a child naturally. The next thing I'm feeling with this hand are your ovaries. I'm feeling each side, checking for the masses, for any masses or tenderness. Let me know if you feel any discomfort anywhere during this part. Awesome. I am taking my fingers out now. Thank you so much. Degloving. The exam's complete. You did super well. What we're going to review right now are any concerns you have, the findings that I've assessed, and we'll schedule your next follow-up. And what you should know is that if anything came back abnormal from your PAP samples, you will get a phone call before our next visit. But if everything looked normal in the labs, you'll probably not get a phone call from me, but we will still discuss your results in our next visit, okay? Do you have any questions for me thus far? Okay, awesome. Thank you so much, Imani. Have a wonderful day.